AI future within nursing training and care. Machine learning, artificial intelligence, virtual reality, and augmented reality are increasingly becoming more applicable within nursing training. The app allows nursing trainees to interactively learn about various physical exams using an image recognition technology which allows them to visualize each body system by pointing a tablet at specific regions on a patient's body. Additionally, students who received lectures and practice sessions combined with virtual reality immersion had greater changes in scores compared to those receiving lectures alone or those without any virtual reality training, p less than 0.05. This sphere provides a safe learning environment where clinical skills can be developed using a variety of simulated scenarios such as trauma or cardiac emergencies, allowing students to assess patients and make critical decisions that will determine patient outcomes. The third goal includes using virtual reality technology for surgical skills training through designing and conducting studies on surgical residents who are trained through VR simulations prior to practice surgery on actual patients, which may reduce errors and patient deaths caused by inexperience. Students are able to receive immediate feedback that will help guide them through each scenario and assess their overall level of performance based on real-time data collected during the exercise, which can be used as a guide for future training. As technology continues to advance, there has been different opinions on whether it should replace classic human interactions such as learning through communication between humans or for students within a classroom setting. In terms of technology that can support medical professionals by improving patient outcomes, IBM Watson is a supercomputer system that has been designed to provide oncologists with the best treatment options for their patients and provide suggestions based on past cases it has learned from and analyzed. Although this is still an emerging industry where testing and research has not fully been completed on how well their machines can gather data and perform at a fast pace compared to the capabilities of an average farmer working on hundreds or thousands of acres, it doesn't take much imagination to see how detrimental it will be to low-skilled farmers around the world. In order for them to do things like drive cars, they must learn from past driving data and their experiences, so if they are able to learn other tasks by themselves, there is no doubt in my mind that we have just opened up a whole new area of questions with the necessary thoughts to address any negative effects involving this technology. As artificial intelligence continues to advance at a very fast pace, we have already begun to see many positive impacts on our society, especially when it comes to business and how they manage their resources more efficiently by using machine learning algos. Some of these advancements in technology include better predictive analytics that help businesses anticipate customer needs and wants, as well as a reduction in human labor, which for some companies could mean slashing thousands of jobs from payroll because AI algorithms are able to do the same work as humans with even higher levels of efficiency. Take for example in healthcare. At the American Medical Association's annual conference recently, there was an interesting panel conversations with physicians which explored how artificial intelligence and machine learning is improving healthcare, as well as what barriers exist to adoption and clinical use. By separating out different layers, myocardium, endocardium, students may visualize how stenosis of coronary arteries affects blood flow through blood vessels that supply each segment of the heart muscle. We have today virtual reality-based applications that can be used at home for self-directed learning, 3D anatomy, Google Cardboard virtual reality.